Interesting, you'll see a patient come back to the office 3 weeks later and it looks like they just had a haircut or something, you know. They don't even look like they had a major heart surgery operation.
There was no pain from the surgery itself. And I never did have any pain from the surgery.
She said, "Where's the surgery? You sure you did the heart surgery?" I said, "Yeah, it's right here. It's a small cut."
In the tri-state area, New York, Connecticut, New Jersey, even Pennsylvania, there's not many centers that are doing robotic cardiac surgery. But when you see someone who goes through the standard operation where we make an incision through the breastbone, and then you see a robotic patient, it's like a world of difference.
That looks wonderful. It has healed very nicely.
The robotic patient gets their breathing tube taken out in the operating room. They're sitting up in a chair in about 6 hours. We have these monitoring lines in and tubes and things like that that we standardly use for the patients after their surgery to monitor them. Those come out very quickly, and the patients could really go to a regular room within about 12 hours. We keep them in the ICU for overnight, and then they go to a regular room the next day, and then they're commonly going home that afternoon or the following morning.
Patients are benefited because there is a minimal amount of incision. There is no cutting of the breastbone, so patients are in less pain, less scarring, less chances of blood transfusion, so overall less chances of complication and quicker recovery.
When the visiting nurse came to the house, and when she saw my scar the first time, it's the first time she had ever seen it, and she was quite impressed and really stunned herself, you know, because she had never seen anything like it.
I checked with my primary doctor. He has an office, like they have a crew of doctors, like about 7, 8 doctors. When I opened my chest, I told him, look, he called all the doctors to look because these doctors, they never saw this before.
Robotic heart surgery basically is a kind of minimally invasive heart surgery. Rather than cutting open the breastbone, we can perform the whole surgery by 1.5 to 2 inch incision from the side of the chest. The robot puts 3 small hands inside the patient's chest, and the surgeon is sitting next door, and this robot is connected with the cable with the surgeon's console. The surgeon does the surgery and all the movements are being translated inside the patient's chest through very tiny 3 small holes, so avoiding cutting open of the whole chest.
It's very gratifying. You know, at St. Michael's here, you know, one of our real missions is to really provide, you know, good health for all the people that cross our path, and the physicians are very dedicated to that. But to be able to provide them a really cutting-edge procedure that a lot of other institutions don't provide, and be able to do that in a way where we get a very good result is extremely gratifying.